Over here in this video, I want to help people if you've been struggling with having a tight hip and you want to be able to feel some freedom, liberty of movement, like when you're walking around, being able to get out of the car or stand up or standing for long periods without feeling the tightness and the restriction. So this video is going to be really helpful for people who've been struggling with hip pain and maybe tried stretches and it maybe hasn't been able to fully get that pain out. I'm going to show you a couple of things you may want to keep in mind, things that we do with our patients that have helped them to get back to 100%. So let's go into the first exercise that I want to show and demonstrate. So one of the things that's important is making sure that we actually address where the tightness is truly coming from. And one of the things about having what's called referred pain or some kind of referred type of tightness or discomfort in an area is that the place where you feel it may not be the place where it's coming from. So depending on what type of stretches you may have already tried before, those things may not have targeted fully what exactly you're trying to address. So one of the first things we want to do is a common area that bothers people in their hip is the posterior aspect is what we call it, so their rear, really right where the bottom is. And so we want to be able to stretch that area out. And I'm going to demonstrate a few stretches for you that are going to be helpful. And these are things to keep in mind depending on what kind of issue you have with the hip. So there are different areas of the hip where there can be pain, discomfort, injury, and even sometimes damage. So by no means are these stretches an answer totally for whatever issue you might have, but these are things that we've used to help our patients depending on what kind of condition that they're going through. So the best way for you to be able to know if a particular stretch is going to be helpful for you is to get an exam, talk to a physical therapist, and get some type of consultation where you can know exactly what's contributed to your pain. So first stretch we're going to do is called a Piriformis stretch. We want to cross that leg over. Now, for people like who've had a hip surgery or who've, are recently after hip surgery, certain movements like this may not even be possible for them. But for the average person who has just kind of maybe they woke up with some kind of pain or had like a mild kind of injury, this stretch is going to be feasible for most people. And if it causes you pain, anything that pretty much aggravates or amplifies your pain is something you want to avoid. But if it's actually giving you a relief kind of feeling, even if there's some discomfort, but it's like a good kind of pain, that's actually positive. And so what you do is you cross that leg, and what you want to do is bring the knee to the opposite shoulder. So we're bringing that knee across, and you're going to feel that stretch right in that posterior area, and you want to hold this. So typically holds, we would hold, depending on what we're trying to achieve, either 15 seconds or 30 seconds. So if we're trying to more so stretch the joint, we'll hold it for a shorter period of time, about 15 seconds. If we really want to stretch the muscle, we need to hold it for a longer period for what's called low load, long duration. So we are putting a low amount of force. We're still feeling some tension depending on how tight that is, but we're holding it for a long duration. So 30 seconds, doing it several times, about 3 times is typically what we'll have our patients do. But again, it just depends on what we're trying to go for. If we're going for stretching out the joint itself, meaning the bones and the space between the joint, we'll hold it for shorter durations. If we're trying to stretch the muscles, we're going to do for longer durations. So keep that in mind. So that's a great stretch to do. Another way to apply this stretch in the inverse is by actually pushing that hip down. So push the knee away from the opposite shoulder. And one of the things to keep in mind is that whichever position of your hip has greater tightness, that may determine which stretch is more preferable for you, which stretch is better for you. So if pulling the knee feels a little bit more effective, that's going to be the one you want to focus on versus pushing the knee down. So keep that in mind. Now, some of the other stretches that are going to be helpful if we're addressing that posterior aspect of the hip, we're going to do some stretches possibly on our back, which will be very beneficial for us. So we'll be in this position here, lying on our back, and we're going to take one knee up to our chest, and we are going to drop that leg down to the side and put one hand here, and we're going to feel that posterior lateral area of our hip, right? This is something someone can do off of a bed, right? But you can do it in this position. You're going to feel that stretch here. Something that's really common for people who have hip pain or maybe have had it for a long period of time or just kind of on and off. One of the things that's challenging is that sometimes they don't realize that the pain is actually coming from their back. And so stretching is not a solution to everything, but for the things that stretching can help, these stretches will be beneficial for people whose injuries or conditions are truly muscular or just joint related that are very mild and not severe at all. So that's a great stretch. And again, depending on how much flexibility you have in your hip, this is really going to provide a lot of compression to the anterior hip complex. So just meaning that inner thigh area essentially. So that's going to provide a lot of compression. So for people who might have other issues going on, groin strains or other kind of things like dislocations in their hip and stuff like that, this is going to be probably maybe too intense for some people. Another way that you can just do it is keep that leg rested on keep your foot rested on your other leg and stretch out like that and feel that posterior stretch there. So let's go into another one that I want to demonstrate. So the same way we kind of perform this in the chair, we're going to cross one leg here. We can simply bring one knee to the opposite shoulder. That may not be as intense, but here's how we can make it a little bit more effective is if we bring this knee all the way to our chest and hold that there. You're gonna feel that really good in that position and it's gonna help. And so again, we're talking about holding for 15 to 30 seconds, depending on what we're trying to achieve. If it feels more joint related, if it feels more hip related in terms of the muscles of the hip. The other way that the last stretch I want to show us for the posterior area is bringing this knee to our chest. And what we're going to do is kick that leg up. We're really getting those hamstrings, but what this also helps us to do is mobilize the joint. So I'm holding this here at my chest, and I want to kick that leg up, really stretch those hamstrings out and mobilize them. Now, typically, this isn't a stretch that I would hold for about 30 seconds. This is more of like a mobilization to actually help mobilize get the hamstring tissue to move better. And then also we're indirectly helping to stretch the actual hip joint itself. Now, why do we want our hamstrings to move better? Well, for people who have hip pain or even a lot of times back pain, tight hamstrings that don't move very well and are restrictive are going to amplify that pain. So this is a good stretch for us to be able to do to loosen up those hamstrings. And again, that's not one that we want to do holding it for 30 seconds unless we're a particular athlete playing a particular sport, like maybe someone who's a gymnast who wants that greater degree of flexibility, things like that. We don't need to do those for a long duration hold. We want to just mobilize that hamstring. So other stretches that we can do to help stretch the anterior complex of our hip, we can have our feet in a butterfly position, feet here, and we can use our elbows to press down. That's going to be a good stretch for the hip adductors, right? We can also kind of kill two birds a little bit with one stone. In this position, maybe either we hold this for 15 or 30 seconds, doing it several repetitions. We can also reach forward like so. That's going to be a really good stretch there. Right? Really good stretch. To get a little bit more on a particular side, let's say I wanted to really stretch this right side a little bit more, I might lean a little bit to one side or lean a little to the other side, things like that. So these are a couple of the stretches that we can do. I'll demonstrate one more that's going to be great. It's a really good hip stretch here on one knee. Let's say I'm targeting this hip and I want to stretch that anterior complex. I'm going to be here, have my knee on the ground, preferably a surface like a pillow or something that's soft and comfortable so the knee isn't, frustrated or, aching because of the pressure. But I'm going to glide my body forward. I'm going to hold. You're going to feel that stretch right in the front in the anterior portion and just hold that. Again, we're talking 15 seconds if we're addressing the joint. We're talking 30 seconds or more if we're addressing the hip muscles themselves. So again, now one of the other things that we can do to get that hip adductor is putting ourselves at an angle to really kind of stretch that inner thigh muscles as well. So instead of being fully straight on, turning at an angle and almost doing like a lunge in a diagonal to help stretch out that side. We're going to get some of the medial anterior hip stretching as well there. So keep that in mind. Hopefully you found these exercises helpful, and these are just very great things to be educated and aware of that we use to help patients improve tightness, discomfort, things like that. Most people don't realize, depending on the conditions that contributed to that tightness, doing a stretch once or twice is not going to solve the problem. There has to be consistency over a period of time in order to get rid of that. So for example, doing this depending again on how tight this hip has been, or also how frequently we're doing activities that are reintroducing aggravating conditions to our hips. So for example, people who are drivers and drive or sit for a long period of time, remote work is super popular. People are working from home or working at desk, and there are some things, some positions where we may sit in that are actually aggravating or reintroducing the stimulus that caused the issue, and we're doing that on a regular basis and reintroducing that pain or discomfort. So make sure that when it comes to the tightness, depending on how long it's been, if it's been several weeks where this pain or this tightness has been there, you're gonna have to do stretches several times throughout the day for probably a week or two or more, which is what we've typically found with the patients that we've worked with. You have to do these stretching, the stretching for longer duration in terms of frequency over a couple of days, couple of weeks before you see a full resolution of the issue, especially if you have activities throughout your day that are putting you in a position that make it so that your hip is even tighter. So keep that in mind, and hopefully you found this video helpful. If you did, like it, leave a thumbs up, subscribe to our channel to get all the helpful information that we make and videos that we post to help you stay healthy, pain-free, fit, and mobile. And I will see you in the next video.